Jackie Richards' prosthetic arms and legs take some getting used to, but her faith helps her stay positive.
I've always had a very blessed life.
She lost her limbs after a near-fatal bout with sepsis.
I went to dinner with my friend, had some sushi, and went to her house and played with her nieces and nephews on the trampoline, jumping up and down. And that was pretty much the last day I felt normal.
2 days later, she went to the emergency room.
Student nurses came in and asked me what the symptoms were, what was I feeling, and I was telling them about the pain in my stomach, and after that I blacked out.
Septic shock put her into a coma for 2 weeks. Her vital functions shut down, stopping circulation into her hands and feet. Gangrene set in, requiring the amputations.
I'd never heard of sepsis before, so I had no idea what that meant when I woke up.
She's not alone. Nearly 3/4 of Americans are also unaware. Sepsis is the body's negative reaction to an infection. Half of all cases come from fairly regular infections like pneumonia or those in the urinary tract. The other half come from infections contracted in the hospital like staph. So prevent infection and you can prevent sepsis. The best defense, wash your hands often. Also, avoid people with infections and strengthen your immune system by getting lots of rest, eating fresh fruits and vegetables, and keeping stress down. Preventing hospital infections is another matter. SENTARA Bayside Hospital in Virginia Beach, Virginia, is rated by Consumer Reports as one of the nation's very best at preventing infections. Their extensive checklist even stops doctors from wearing neckties because ties are never washed. Bayside's low infection rate translates into high patient satisfaction.
I'm a germaphobe myself, so I felt right at home. I did. You see, I've got my own hand sanitizer.
Bayside pays particular attention to one of the main causes of hospital infections, medical devices inserted into patients.
We would consider anything that is attached to a patient, such as a ventilator tube or an IV line, as extension of the patient. And even if you're just manipulating that and not touching the patient's actual body, you're supposed to wear gloves.
In addition to cleanliness, those devices must be removed as soon as possible.
We try to get patients off the ventilator as soon as we can, and that goes for all devices. We would round each and every day on every patient, look at all the devices they have. We'll document if they need it or not need it.
Although hospital staff are largely responsible for keeping patients healthy, there are things patients can do to protect themselves. Dr. Jean Burke oversees all 10 of SENTARA's hospitals.
And every patient should feel totally empowered to say to everybody that walks in the room, have you washed your hands? Would you mind doing it now? Because doctors' hands aren't going to fall off for washing them too often.
Patients can go even further in monitoring their own care.
Talk to your care team and basically try to help them know that you expect to have the fewest number of things put into you that's necessary, and that you would like them every single day, if you have a catheter or an IV in, to answer the question, is it still necessary today? Every single day, ask and answer that question.
While it's important to minimize infections, when they do occur and develop into sepsis, the treatment is antibiotics and fluids immediately, because every hour without them, the chance of survival decreases 8%. By the time Jackie was treated, her chance for survival had dropped to just 15%. So although sepsis took her hands and feet, at least she still has her life.
I take every day as it comes, and I'm thankful for every day that I get.
Lori Johnson, CBN News.